August last year, we published an article about the thousands of homes that still needed to be rebuilt in St. Martin. In January this year, the Secretary General of Rome informed the members of Parliament of the Kingdom at the IPCO meeting hosted here in St. Martin that the hurricane damaged 70 to 80% of available housing in St. Martin. He said that currently St. Martin counts 19,000 housing units. Based on this publication, we calculated how many homes have to be built back better and stronger. If 13,000 to 15,000 homes have been damaged by the hurricane, we are now in May of 2019, 1 year and 8 months after the passing of Hurricane Irma. We are asking, how many of the 13 to 15,000 homes in the southern side of the island has been built back better and stronger? Is not it the government that has to provide us with this information? Is not it the Parliament that has to request to be updated by government how much homes have been built back better and stronger, and how much homes still have to be rebuilt in a more resilient manner? So far, this information is not being provided. Until now, the government in its weekly press conferences has not provided this information. Is not it the Ministry of Rome who is responsible for public housing, Volkshuisvesting? The Minister of Rome has not provided how much homes have been built back better and stronger since the hurricane. Neither did the Minister of Rome nor the Ministry of VSA responsible for social development and social affairs. The Ministry of Rome announced since November 2017 a roof repair program for 300 to 350 homes. 5 million Antillean guilders were allocated to replace T111, rafters, and or sink. Priority would be given to persons who are renting from government, pensioners who own their own homes and have a monthly income lower than 4,000 guilders, unemployed homeowners who are receiving social aid, and homeowners who rent out rooms or apartments and their total income is less than 4,000 guilders. The government was brought down, an interim government was formed, and elections were held. What did the new Minister of Rome do with the roof repair program and the monies that were budgeted to repair 300 to 350 roofs? The Ministry of Rome organized a press conference in March last year on a home and roof repair program. The ministry had announced that everybody could build back if the building permit was not changed. But for changing of the building permit, a new building permit had to be requested. Based on that information provided, we as Consumers Coalition have requested a meeting with Rome twice, which until today it has not been granted. We want the government not to focus on home repair, but on rebuilding homes better and stronger. So we know of a lot of constructions people started which was stopped by Rome inspectors. Those who got back money from the insurance companies could rebuild back the house in the same condition that it was. A new building code has been introduced meanwhile to build more resilient homes. In other words, should not all existing building permits and construction be reviewed and evaluated to be resilient? Parliament was informed that 1 year after Irma, only one roof had been repaired by government. We have the following questions for the Ministry of FROMI. What is the status now of the house and the home and the roof repair programs? Who got their roofs repaired? How many roofs were repaired? How many of the unlivable homes have been rebuilt? So far, we have not heard the ministry in none of the press conferences about the project in preparation to rebuild back better based on the new building codes to be more resilient.
It's been said that behind every door, possibility awaits. How much possibility depends on which door you open first. Every day, we help our customers discover the possibilities in their lives. It all starts with a conversation. Scotiabank. Discover what's possible.
GEBE has been faithfully serving the communities of St. Martin, powering your home and our economy. Come rain or shine, our qualified team of professionals are working hard 24 hours a day to provide you and your family with safe, reliable electricity and water. We use the latest technologies and test our products daily to maintain the highest international standards. Our friendly staff is always there to assist you, whether in person, over the phone, or online. We are committed to constantly improving our products and services, making them more efficient, effective, and environmentally friendly to serve you better today and our next generation of clients tomorrow. GEBE, powering a brighter future.
Our friend Megawati is here with tips to save you energy. 1. Turn your airco temperature up. 2. Use a ceiling fan instead. 3. Buy energy-saving products. Save some green with NVGEBE.
I'd like to thank Dr. Ramos and Dr. Rojas, the two urologists. The feedback that I've had from the community has been tremendous. And one of the things, and to our Minister of Finance, indeed, I think we are going to see, or we are already seeing, an increase in some expenditures regarding, for example, the urology department. We're seeing a number of things, actually. We're seeing that the referrals abroad have dropped way over 90%, which means that the money we're spending, sending people abroad, paying for plane tickets, hotel accommodations, and companions, is dramatically reduced. But we are seeing that because we've reduced the barriers to access to care, in other words, before if somebody felt that they had a problem, they maybe waited until it became a more serious problem because the process of getting referred and traveling abroad and approvals was a cumbersome process. And by making it easier for people to access the services, by reducing that barrier to care, we're finding that more people are going at a much earlier stage. And indeed, what the urology department is reporting is that they are finding more instances of people with early stage problems. In other words, cancer, but at an early stage. But what does that mean? It means that with the investment in the equipment, we can treat those things now. We can treat them at a much earlier stage so we maintain the people's quality of life. And what we're doing is we're reducing our long-term costs. So these cases which we're finding now, which are, yes, translating into some financial expenditures at a much lower level, and that money's being spent in our economy. But if we didn't, these are cases that would evolve into much more expensive cases in the future, much more complicated cases, and also at a point where people's health would be much more impacted by the illnesses then. So I'm very proud of the work that we're doing and I'm very proud of the services that we're offering and impressed. They demonstrated some of the equipment, or they showed us some of the equipment. They have new equipment coming in as well. They have ordered a laser which they can use for treatments. Again, these are all things that in the past we were sending people abroad, and instead now we're making those investments locally, and we're treating the people locally. And the skill sets, and this ties back to the nurses, what we're seeing the staff, the management, the specialists, everybody's excited about the progress that we're making. And we still haven't seen the new hospital yet. So we're going to see this escalate on a exponential scale as soon as we begin with the actual construction. All of these referrals before were referrals abroad. Whether it was to the French side or to another country, it meant the whole administrative process, the application process. So it meant time, it meant cost. All of that administrative process costs the system money. And this is all money that we can save now and invest directly into our healthcare expenses. You know, one of the other interesting discussions yesterday is the neurology office was right there in the same new section. And yesterday alone, the neurology department saw 20 patients. All 20 patients would have previously been referrals abroad. So imagine, those referrals are now again that's money that's being saved. Instead of sending 20, maybe more, right? If it was more complicated, they would be sent with a companion as well. So somewhere between 20 and 40 patients that we would have had to pay for their travel expenses, their hotel expenses, time away from work, time away from family. All of that now we're doing locally in St. Martin. So I couldn't be more proud of the progress that we're making. And this is a progress that's the result of partnership between SZV, the SMMC, and the government. And I was very happy to hear that they were appreciative of all of the support that the government has been giving them in terms of their progress. So very, very pleased with the steps that we're making. And it's clear demonstration, another milestone, and proof that we are very much on the right track.
Hey ma, how you doing? You busy?
I hear, just paying some bills, taking care of business, you know what it is?
I know, you're doing your online banking.
I don't have to stand in those long lines to pay bills. I can transfer when I want. I can check my account wherever. It's like the bank open 24/7. I even here checking the statement right now as we're talking. How's Miami?
Well, that's why I'm calling. I'm finishing up a few songs now, but I'm afraid that studio time might be more than I thought. And I was wondering if I could get some help with some funds, and I could pay you back as soon as I get back to St. Martin.
Let me check my account. How much you need?
I think 500 should be enough.
I can transfer it to you while online. Direct from me to you. No problem.
Great. Thank you so much, Ma. I'll get online with Wib now.
Alright, darling. You know who you're for?
I need to know who you're for.
Contact Wib today for your complete personal online banking experience. Available for all mobile devices. The Wynwood Islands Bank, now your online banking partner in progress.
Who you're for.
All of the services that GB provide to its customers is considered customer service. The manpower assessment pertained to the entire GB organization. Furthermore, the conclusion is that the company is not overstaffed. However, the assessment did show that there is some organization realignment needed. MP then asked about the 37% personnel cost. What exactly is the car allowance and rent allowance? Are these current buildings that GB is renting? How many buildings are being rented for this money? The car allowance is given to the department heads and meter readers and disconnectors. This allowance is for the use of their vehicles to carry out GB work and a benefit allowance. The rent allowance is a benefit given to employees with staff agreement contracts and are renting a home. This has nothing to do with buildings that GB rents, but is an employee allowance. Tuition fees, what is meant with this? Is GB sending students away to study? This is an allowance for employees that wish to improve their skills related to their function. GB is not sending students away to study. The studies are mainly local or online. MP then asks other personnel expenses, what is meant by this? This is a reservation for all other miscellaneous expenses related to personnel. MP then asked to provide a breakdown of how much money government owes to GB at present. And as of December 2018, GB will have a settlement agreement with the government, offsetting monies owed and concession fees. As of that time, there are no outstanding amounts. The information since January 2019 is not determined as yet. The plan is to have a yearly offsetting of expenses with settlement agreements. And then MP Jules James asked about redundancy. The EDF has established a generator facility in Bellevue, awaiting agreement with GB for outages. Please provide information about this. And GB met with EDF representatives. This is an interconnection plan being worked out for Colby and for Belvedere. GB is also awaiting financing for this initiative. MP. That concludes all the questions, Madam Chair.
I would like to get a bit more clarification on, and that's the monies owed to GEBE from government. At one point in time, Madam Chair, the minister said there's no monies owed, and then he said there's a settlement agreement that should be sometime in 2019 or 2018. Which one is it? And if it's a settlement agreement on what? There must be an amount. There must be something that you're settling on. And if there's no monies owed, then why are you having a settlement agreement? So that's why I asked the question: how much money is owed to GEBE from government?
In 2016, GB did a settlement agreement where we settled the concession fees that GB have to pay to government versus what government have to pay to GB. Since that, government has been paying bills sporadically, but then in 2018, we determined that we will do a next settlement from all outstanding, and plus GB had 2 years of concession fees open. When we put everything together at the end, GB is the one who will have to pay government of over about $2 million that we will have to give to government, and we hope to sign the settlement agreement within short. And going forward, it was established in a shareholder meeting that every year we will do quarterly. So we will continue with offsetting concession fee versus government bills.
Their border connection, it's about 4 million guilders. And then for the Colby connection, it's about 2 million guilders. That's just rough amount. It could be more, but what we have projected for now. And again, it's us also feeding the French side, and then the possibility for the French side to feed us where necessary.
High cost figure that is being used for the supervisory board of directors for GEB. Madam Chair, when I look at a total amount of 885,000 guilders that the board needs to run an annual basis, Madam Chair, is very alarming for me. I would ask the minister to seriously look at the budget of the supervisory board for a board to operate for 885,000 guilders. Madam Chair, in this day and age, something is definitely is not sounding too right in my book. When you look at the breakdown and you see the amount of money that is going for even training consultant, 100,000 for the board, travel budget 120,000, unexpected expenses 101,000, administrative support 84,000. Madam Chair, to me this is alarming for a company like this at this time. I will ask the minister through you, Minister, see if you could pass and have a discussion how we could hatch it in this time for this budget to reflect the times that we're in. GB needs this money more than ever for investment. I would ask, through you, Madam Chair, to the Minister to seriously reconsider and find ways and means to trim that budget as much as possible. I think it's alarming that you have 6 members on a board and has a budget of 885,000 guilders. And then you ask your question, how are we intend to save for the company?
Just want to wine and shit. I notice she only but I can't let she get away. So I ask she to dance with me. She laughing and only I just want to wine, is that okay? She grab up my hand and say, when the girl wine at me, all my troubles float away. Now the whole party breaking away. When she said what she said, now she rolling back on me and she body something. Oh yeah. Now she looking back at me and she body something. Oh like now, boy was like now, it's day like now, cause she like when everything is now. Why the baby is now? Why the baby is now? Cause she like when all I love with dancing Zuki. The girl only dancing with me. Every man in the party. She says she don't want to party. She just want to dance with me. She don't care for everybody. Oh, let me get some game in her bed. She grab up my hand and say, when the girl went on me, all my troubles float away. She not in the middle of the sun. See it when waist now. Wine by the waist now. Wine by the waist now. Cash here like grass. Listen, Martin. How you feeling? You feeling nice? Look what? I want you to do your favor, please. You tell me that this is a song to whole soca rumble with it on. You tell me everybody know this song. So what I want you to do for me? I want you to help me sing this song. Y'all can do that for me. Now listen. All I want you guys to say is juke it, baby. Juke it, baby. You can do that for me? Let me try this time. Let me go. Let me hear you. One. Sing it. Juke it. Look. Sing it. Juke. Oh man. Okay. This side good. Let me check this side over here. You ready? One. Yeah, you sing. Two. This side go sing. One. Two. Juke it. Look. Sing it. Juke it. Oh man. Juke it, man. Okay, this side good. I can't leave without checking this one right here, this side in the middle here. I got to check this side here.